Leprosy in India by Curt Casteel. Current state. Leprosy in India is an undeniable issue that is continuously spreading each day. India has the highest rate of new leprosy cases in the world and accounts for more than half of all cases detected annually, at about 60%. This is a very high percentage. This concern has been recognized by government officials, but they refuse to understand the magnitude of the situation and allocate sufficient resources. The problem is the stigma surrounding this disease. Oftentimes, individuals are in fear of being diagnosed due to the social repercussions that come along with being a carrier. Leprosy in its initial stages doesn't have any symptoms, so many times individuals also don't know they have it. Leprosy cases are at an all-time high, decade high, and little has been done to counter further spreading. This is a present issue in India's current healthcare system because they have neglected to supply resources, causing stigma around leprosy to grow and worsen. Reasoning. The major cause of hitting cases is low voluntary reporting in the community due to lack of awareness, as well as stigma and discrimination. The extent of stigma and discrimination is evident by the fact that 200,000 people are residing in about 750 leprosy communities. This shows us that people are scared to surround themselves with others who have tested positive for leprosy. Our plan. Our overall goal is to decrease the number of transmissions in India, resulting in less deaths and a healthier community. Our plan is to create a campaign to lessen the stigma of contracting leprosy in communities. During this campaign, we hope to bring awareness to the dangers of going undiagnosed while creating a community of infected individuals who are searching for help. In creating this community, it will give those who are infected others to turn to. We hope to reduce the amount of individuals who postpone doctor's visits in fear of testing positive directly, which will directly cut back on transmissions. If people are not scared to go get tested, the amount that leprosy spreads will lessen. We want to discuss laws that were enacted before this disease was curable and express how severe and unnecessary they now are in current times. Minister Dr. Harsh Vandhan had written to the chief ministers of 23 states and UTs and to the Union Minister of Law and Justice and Social Justice and Empowerment, seeking the expeditious amendment in these discriminatory laws. Working together with Dr. Harsh, we can show officials how outdated these laws are, which will be helpful when requesting funding. Strategy. First, we will identify the hotspots or communities with little resources for individuals and high transmission rates. This will be determined by the total number of cases reported in the last 5 years. Next, we plan to campaign in these areas, spreading knowledge about leprosy and giving individuals options for ways to continue to live normal lives. If we can offer a way to live for individuals to continue to live their lives, they will not be in as much fear of contracting this disease. How will we do this? Explaining the evolution of treatments for these diseases and how it is now curable will be a big part of this. We will also create advertisements that bring sympathy to the infected and offer ways for those who are not involved to supply help. Instead of other individuals in these communities living in fear of lepers, instead they can use their resources to help the cause. Persuading government officials to abolish any laws against leprosy that are outdated or may not be fair will be a big part as well. Lastly, we will analyze the results of this solution and determine the impact it has had on communities. Assuming that our solution is helpful, we would like to continue to move to other areas of India with this proposal. Our end goal would be to be in all areas of India, having the largest impact on transmission rate. Needed funding. Our initial desired investment in this policy is roughly $100,000. India has funding available for leprosy care, but in past years has reduced attention to research and funding of leprosy programs in general due to the false interpretation of prevalence levels. In bringing more attention to this disease, we hope that we will show government officials the magnitude of the rate of leprosy is spreading annually and prove to them that it is not just more people testing, but instead more people who have leprosy in general. Donations from individuals or their families who are directly affected by this disease will also be very helpful. Members of the community who show sympathy for those lepers will have the option to use their resources to help. Each of two phases will split the funding sum until other investors are found. Our first step will consist of campaigning and spreading awareness through advertisements, social media, and other ways. Our second step consists of allocating funds to independent groups fighting the spread of leprosy. This will be very helpful in our end goal of decreasing transmission rate, because the more individuals working towards our end goal, the better. An example of a group would be the National Leprosy Eradication Program. Obstacles. There are many obstacles that we will have to go through in proposing this solution. One of these are unfair laws that are enforced in India, like the Lepers Act, that separates men and women and puts them in jails or secluded areas. In 1898, this act was created when there was no cure for leprosy and people were banished to colonies from cities and towns to stop its spread, perpetrated in the historical discrimination against those affected. I understand that how in 1896, this was maybe their only option, but now that leprosy is curable, I do not agree. Instead of modernizing these acts, government officials deny that the disease is spreading. They claim that the increase in cases is not due to transmissions, but instead from the increase of members testing in communities. In the early 2000s, there was a reallocation of resources and a gradual decline in funding for leprosy-related programs by government officials. Policymakers are at direct fault for this, and day by day it is causing more unnecessary division between members of their communities. Without the government officials using their resources to lessen the stigma that surrounds leprosy, they're directly at fault for the fear that those who test positive live with. Laws are still enforced that include barring patients from standing from election and charging them higher health insurance premiums. This is very unfair because the majority of people who end up testing positive for leprosy come from poor communities and don't have the necessary funds to treat their disease. Keys to success. Approval for funding. Our first key to success is approval for funding from the government. Our next key would be finding a team that is passionate about making an impact for the better. Finding individuals who are also passionate about the same solution will be very helpful. Next, we will create an informative campaign that can educate the public. After this, we will attempt to abolish unfair laws against lepers. Then we hope to reach as many people in India as possible, especially those in hotspot communities. Lastly, we hope to spread to other communities using this same strategy while analyzing results to maximize impact. Thank you.